Good morning, and welcome to this week's episode of Ask Dr. Murphy. I hope everyone is doing well today. My name is Katie Berg. I'm a research study coordinator with the Havey Institute, and I'll be leading today's discussion. I'd like to welcome and introduce Dr. Robert Murphy. Dr. Murphy, how are you this morning?
Doing great, thank you.
Dr. Robert Murphy is the executive director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine. He answers your COVID, infectious disease, and public health questions each week here on the Havey Institute's Facebook page. Today, Dr. Murphy will be addressing the latest headlines, answering those viewer-submitted questions, and our lone U.S. COVID statistic through today, April 17th. We invite you to submit any questions or suggested topics down below or via any of our social media linked in the description. Starting with that COVID statistic, average COVID deaths per day in the last week were 48 daily. The same week in 2024, we saw 105. Dr. Murphy, your reactions to those numbers?
Well, really no change for the last couple of weeks. We're at the tail of the current winter respiratory season peak. COVID's going down. Most of the wastewater activity in the United States is at the low level. There's a little bit varies around the country, but the cases are down. But the death rate is kind of stuck at this, high 40s, 50 number. So that's still, quite a few number of deaths per year if this stays the same. So, but it's a big improvement over last year. So it'll be interesting to see year over year how this pans out.
Absolutely. And our first submitted question today comes on the back of some topics we talked about last week, which is with Dr. Peter Marks, the FDA's former top vaccine expert, now gone from the agency. What will happen to that process of vaccine or gene therapy approval?
Well, Peter Marks he's a great person, an expert in vaccines, and was really responsible for leading the approval of multiple vaccines over his tenure at the FDA. I mean, it's very unfortunate to have him basically have to leave the FDA. I'm sure he's going to do well. He's an incredibly smart person and a dedicated public servant. There have been other resignations there as well. It's unfortunate to basically have these career scientists, with all this expertise and have done so well in their career to not be there anymore. It's unfortunate. We worked with him on our COVAXIN project, which was during the COVID pandemic. We were evaluating vaccines and not only the science, but the communication that went along with them. And he was very supportive of our efforts, and actually we interviewed him, and he was a really great resource. So we'll miss Peter Marks. He was one of the good ones.
Mm-hmm. And that's not to say things won't still be approved. Maybe they'll just have different pathways, or the types of things that get approved might change.
Yeah.
It's all speculation at this point, but
the approval process was put on hold. But just yesterday, the CDC advisory committee, 15 independent advisors, did make some vaccine recommendations, including widening the RSV vaccine, respiratory syncytial virus vaccine, to include people down to age 50 if they have any underlying diseases. They approved a new meningococcal meningitis vaccine by GSK Pharmaceuticals, big pharma that also has a vaccine division. And they approved a new chikungunya vaccine for people traveling to areas where that virus is present. So they met and they made all these recommendations. So, I think things are working again.
yeah, that is a very positive note to see that the systems are still in place and working. And speaking of those systems, our next question is about our next big topic, which is what has the CDC been able to do or done already to fight this measles outbreak?
Well, CDC's been up and down with this whole measles epidemic, which is not going away, is getting worse. There's now well over 700 people who've been infected with measles. The numbers are just really going up a lot, including 3 people who've died and multiple people, hundreds of people who've ended up in the hospital, mostly children. So what are they doing? So they've just redeployed another group of people to help at the state level because this thing is spreading and the numbers are not going down. Everybody that's vulnerable, which is everybody who hasn't been vaccinated or had measles in the past, is at risk. And it's just what they're doing is not enough. We had the same thing here in Chicago when we had all the immigrants here, and many of them didn't have we didn't know their vaccination status, and there was an outbreak among them. And it just took everybody to get vaccinated, quarantining people at risk, and the whole thing went away. That's not happening in Texas and the states where they're reporting all these cases. So a lot of this is due to these cuts in the delivery of the vaccines and the support of clinics that provide the vaccines. So, on one hand, we've got the vaccines, we have a team of people working there. On the other hand, many of the public health infrastructure has been affected. So this is going to continue.
And on that same note, I understand there's been small groups of cases popping up, not just in Texas and the surrounding states, but all over the country. And also that we may be underreporting those case numbers. It's hard to know exactly how many there are.
Right, we'll never really know, but we can estimate. Because now everybody is really looking for measles cases because there's so much out there. But what started in one county in Texas, spread to New Mexico, and then Oklahoma, also has impacted Michigan, Pennsylvania, Indiana, Kansas, and Ohio. So you can see it's getting out of control. And why is it in those places? Where it's popping up is where there's not a good enough immunity. Measles is the most transmissible disease we have to work with. With the vaccination rates dropping around the country, of course, the places where it's dropped the most, there's more people at risk, they're going to get it. It's just so contagious.
Absolutely. And like you've pointed out on previous broadcasts, the initial area of the outbreak has one of the lowest known vaccination rates of measles specifically.
Yeah, you have to have between basically 93 and 95% immunity, in other words, from the vaccine or previous measles, to be for the population to be protected. And so as soon as you drop below that number, and that's a very high number, but we had it in most of the United States and back in 2000 when we had no measles cases at all. So it can be done, but now there's so many exemptions and it's a person's right to be at risk for measles. Okay, this is what's going to happen. This is the price we have to pay, including the 3 deaths and the hundreds of hospitalizations that have occurred.
Mm-hmm. And talking about that elimination status, is it possible that the United States loses that elimination status if this outbreak continues to grow?
Yeah, right. I mean, this thing is going to get worse.
Mm-hmm. Really not on the right path. But
No.
looking elsewhere, looking globally, we have more reports of not the H5N1 avian flu in people, but a different strain over in China. Can you tell us about that?
Yeah, this is the H9N2. It's also an avian strain. And it's being reported. 3 more cases were reported of avian flu over there from 3 different provinces. So also probably grossly underreported, as it is here. Mostly these are kids, a 7-year-old girl from Henan province, a 5-year-old boy from Guangxi province, and a third from Guizhou province, who also got sick in March. So this adds to the 11 cases that have been reported. This thing is going to be everywhere. There's a lot of open markets where, there's a lot of birds in there and stuff. So these people were all in contact with birds that were infected.
Mhm. And speaking of those open markets, not just over in Asia, but looking at the situation here in the US, I understand not human cases, but there have been more poultry found in a New York, same thing, poultry market that have been infected.
Oh, yeah. I mean, we've already culled 168 million birds. That's why the price of eggs are up. It's, cattle herds are being impacted as well. 17 different states, by the way. So, this is also not going away.
Mhm. Now, there is another illness that we talk about here and there that can be a bit of a canary in the coal mine, as some people say, of how infections are growing here in the US.
Right.
This one is whooping cough or pertussis. Can you tell us about the trend we're seeing in those cases?
Yeah, so we used to not see very much of this either when the vaccination rates were high. So, but so far in 2025, we've had over 7,000 cases reported, which is more than double what happened last year. And last year, in total, um, there was 35,000 cases. And that was compared to a total of 7,000 cases in 2023. And 10 people in 2024, 10 people, mostly infants younger than 1, died from pertussis. So it can be fatal. And, many states are reporting cases of Louisiana, North Carolina, and Michigan. And it's out there. So it's yet another disease that's preventable, that's popping up where it shouldn't be.
Mhm. And a lot of people don't realize that that is a vaccine. You have to get it more than one point in your life. It does wane over time. So, very important to make sure that you are up to date
Keep
on
up
that
with
vaccine.
your vaccinations. The same is even true for measles, but even with one shot of measles, you get like a little over 90% of protection. And then that goes up to like 97% with the second shot.
Mhm. And our last topic for today, we mentioned it briefly earlier, but on that vaccine topic, there was an approval for that chikungunya vaccine in Brazil, where a lot of the toll of that disease takes place. Can you give us some background on the disease and then the vaccine as well?
Yeah, so chikungunya is another one of these viruses that they all present with fever and malaise and, feeling sick, and, they don't know if it's malaria or what it is, whatever it is. So it's Brazil in particular has a lot of cases of chikungunya. Probably they're reporting a lot because they have a pretty established medical system and surveillance system. So they're very good at reporting these diseases. So um, since the beginning of 2025, approximately 80,000 cases have been reported. I mean, that's huge. And that includes 46 chikungunya related deaths. And that's 46 deaths reported in 14 different countries and territories. But I mean, so this can also be a fatal disease in a small proportion, but still, it can be devastating. So anyhow, this company, Valneva, it's a French biotech company, announced Monday that the Brazilian health regulatory authorities have approved their vaccine, a live attenuated single dose vaccine for use in people 18 years of age and older, and making it the first approval of a chikungunya vaccine in an endemic country. Brazil is considered endemic. So this is good news. There's another thing that can be prevented.
Absolutely, a great step forward and a great reminder to always check your state or federal resources if you are traveling to see if there are any travel related vaccines or medications you should look into.
Yeah, I mean, and the CDC did recommend, one of the recommendations was chikungunya vaccine for people traveling to areas like that.
Yes, so something to look out for and some good news to end the day with. But on that note, I'd like to thank you, Dr. Murphy, for your time and your expertise, bringing us the latest case data and letting us know what's going on around the world.
Well, thank you, Katie. Have a good weekend.
Thank you. And thank you all for joining us for this week's episode of the Ask Dr. Murphy series. Thank you for sending in your questions and suggested topics. If you have any more, please leave them down below. And we'll see you next week. Have a nice weekend.
Bye-bye.